Hello, I am Dr. Lovenish. I am Associate Professor of Surgery at Maulana Azad Medical College, New Delhi. Today we are going to show you a demonstration of central venous cannulation through the internal jugular vein route. For this, the ideal position of the patient is 15 degrees head low and the head is turned to the opposite side. We are going to demonstrate on the right side. So, the head goes to the opposite side. The entire area is cleaned inside out and the entire thing has to be draped properly to ensure there is a proper asepsis and all aseptic precaution has to be there. Then you identify your landmarks, feel for the sternal notch, feel for the medial and lateral heads of sternocleidomastoid and identify the triangle. That is the apex of the triangle. Feel for the carotid artery. Your vein will be lying just lateral to it. The site for puncture is the apex of the triangle found by the medial and lateral heads of sternocleidomastoid. You introduce a needle and initially just do the skin puncture, and after that you keep on advancing your needle and the direction will be towards the ipsilateral nipple, that is on the right side, and along with that you keep on aspirating it till you get the blood in the syringe. So, that is it. We have already entered into the vein. The next step will be the introduction of a guide wire. Push it in. While the guide wire is being inserted, ensure there is no resistance, and ideally this procedure should be done with the ECG monitor, because if the guide wire is too much in, you are going to hit some of the nodes of the heart and that may cause arrhythmia. So, that control has to be there. So, keep a watch on the ECG. Once the guide wire is in, somebody stabilize it and will remove the syringe and the needle assembly. Just hold the guide wire. Just hold the guide wire. This assembly is now taken care of, and just to avoid any contact with the shafts, I will remove it from my field. The next will be, we usually make a small nick with the help of a blade 1 or 2 mm that facilitates the introduction of the introducer. Dr. Janvi is putting the introducer. This sheath will be used for the dilatation of the tract. Be gentle, don't pull it, just advance it over it gently with a rotatory action. Just advance it. Remember, the vein is only 1 to 2 centimeters deep. It is between 1 to 2 centimeters. So, you should not be going deep. Once enough dilatation has been done, again we will take the dilator off. The guide wire stays in, and that is the time we will introduce the already available, commercially available, the central venous lines. Most of these lines have a 3 lumen or 3 channel. So, that helps in giving multiple infusions, and in case one of the channel is blocked, the alternative can be there. Introduce it, yes, like this. So, over the guide wire it will be introduced. There is a specific marking that it has to go to a very specific mark. Again, while introducing, keep a check on the ECG. So, Dr. Janvi has introduced it, it is already into the vein, and this is the time that we will withdraw the introducer and keep on advancing our catheter. Remember, all of this has to be done with all proper asepsis, because any kind of infection here you are going to introduce directly into the bloodstream. So, that needs to be taken care of. Once the catheter has been introduced, just keep your hand. This has to be connected with the IV line or fluid line. You will see the blood coming in here. You can close these channels. We have these options here. You can always close this channel and utilize whatever channel you want to. Once you are sure there is a good flow with this system, that is the time that we have to fix the catheter. This catheter has two small openings or two holes here, and ideally there has to be fixed with a suture. It has to be sutured with the skin. So after the suturing of the skin, this enables that this will not move. It is sutured with the skin, and then it will be covered with the clean aseptic dressing. You just put it over. In case you have a transparent dressing available, that will be very nice, because it keeps on telling you, it keeps that entire thing is clean, and whenever it is some kind of you find contamination or any kind of dirt etc. is there, that is the time you remove it. Ideally all this dressing should be changed every alternate day. So once dressing has been placed, the lines are functioning and the procedure is done. So patient comes back to its normal position, table is corrected, and whatever the drugs are to be given, life-saving drugs, chemotherapy, parenteral nutrition, anything that is for the central line is to be used. So this is me, Dr. Lovenish, and Dr. Janvi for this procedure. Thank you. हो गया.